This is my continuing coverage of the health care bill. We are on page number 90 right now. This is Part 5, Reinsurance and Risk Adjustment, Section 1341, Transitional Reinsurance Program for Individual and Small Group Markets in each state. Now, from my understanding here, we have health insurance companies like Blue Cross and Blue Shield, United Healthcare, you name it, we got them. Now, here is how this works. Because these health insurance companies are taking in all these high-risk patients, okay, now what that means is that these people have pre-existing conditions. They have heart disease or kidney disease or whatever the whatnot. What these insurance companies do, because they're afraid of all the claims that are going to be made by these people that have pre-existing conditions, is that the health insurance companies buy insurance for themselves. Okay, and this is to ensure that if the insurance company starts running out of money and can't pay on all these claims, this insurance they bought into will kick in and pay for some of that themselves. It's kind of a share the risk type thing. Okay. It says, in general, each state shall, no later than January 1st of 2014, which we have now passed, include in the federal standards or state law or regulation the state adopts and has an effect under Section 1321B, the provisions described in subsection B, and establish or enter into a contract with one or more applicable reinsurance entities to carry out the reinsurance program under the section. Model regulation in general in establishing the federal standards under Section 1321A, the Secretary in consultation with the National Association of Insurance Commissioners, or NAIC, shall include provisions that enable states to establish and maintain a program under which, now notice they're saying that the states are going to establish these programs, health insurance issuers and third-party administrators on behalf of group health plans are required to make payments to an applicable reinsurance entity for any plan beginning in the 3-year period beginning January 1st, 2014, which, of course, we are now past. Okay, so United Healthcare, Blue Cross Blue Shield, and any other company like that, they actually have to buy reinsurance insurance. They have to make payments to it. Okay, that's what that's saying. The applicable reinsurance entity collects payments under subparagraph A and uses the amounts so collected to make reinsurance payments to health insurance issuers described in subparagraph A that cover high-risk individuals in the individual market, excluding grandfathered health plans, for any plan year beginning in such a 3-year period. So, in other words, when the health insurance companies start to get the claims from these pre-existing medical condition people, they send part of that claim to the reinsurance company, and the reinsurance company pays part of that claim. Okay. High-risk individual payment amounts. The Secretary shall include the following in the provisions under paragraph 1. Determination of high-risk individuals. The method by which individuals will be identified as high-risk individuals. For purposes of the reinsurance program established under this section, such method shall provide for identification of individuals as high-risk individuals on the basis of a list of 50 but not more than 100 medical conditions that are identified as high-risk conditions, and that may be based on the identification of diagnostic procedure codes that are indicative of individuals with pre-existing high-risk conditions. So in other words, these people have a list of 50 plus conditions that are considered high risk. And so when United Healthcare or Blue Cross Blue Shield or any of these other companies decide to make a claim, they can say, okay, the patient we're making a claim on has one of these medical conditions. I don't know what that list is, they don't tell, but anyway. If somebody knows where the list is and they want to tell us what it is, down here in the description, or the comments below. Any other comparable objective method of identification recommended by the American Academy of Actuaries. Payment amount. The formula for determining the amount of payment that will be paid to health insurance issuers described in paragraph 1A that insures high-risk individuals. Such formula shall provide for the equitable allocation of available funds through reconciliation and may be designed to provide a schedule of payments that specifies the amount that will be paid for each of the conditions identified in subparagraph A. So, in other words, the reinsurance company will pay Blue Cross and Blue Shield or United Healthcare or whoever the heck else it is. They'll pay them a certain amount for a heart patient, a certain amount for those having kidney disease, a certain amount for diabetes, so on and so forth. And each amount will be different, because some of these chronic illnesses don't cost as much as others. Okay? To use any other comparable method for determining payment amounts that is recommended by the American Academy of Actuaries and that encourages the use of care coordination and care management programs for high-risk conditions. Determination of required contributions. So this is how they determine how much the insurance companies like United Healthcare and Blue Cross and Blue Shield, how much they're going to have to pay these reinsurance companies. In general, the secretary shall include the provisions under paragraph 1, the method for determining the amount each health insurance issuer and group health plan described in paragraph 1A contributing to the reinsurance program under this section is required to contribute under such paragraph for each plan year beginning in the 36-month period beginning January 1st, 2014. The percentage of revenue of each issuer and total costs of providing benefits to enrollees in self-insured plans or on a specified amount per enrollee may be required to be paid in advance or periodically through the plan year. Specific requirements. The method under this paragraph should be designed so that the contribution amount for each issuer proportionally reflects the issuer's fully insured commercial book or business for all major medical products and total value of all fees charged by the issuer and the cost of coverage administered by the issuer as a third-party administrator. Okay, whatever that means. The contribution amount can include an additional amount to fund the administrative expenses of the applicable reinsurance entity. So the fee that the reinsurance company is going to charge to these health insurance companies is also going to include the expense of the administrative costs of the reinsurance company. The aggregate contribution amounts for all states shall, based on the best estimates of the NAIC and without regard to amounts described in Clause 2, equal, well, let's see, that's going to be about $10 billion for plan years beginning in 2014, $6 billion for 2015, and $4 billion for plan years beginning in 2016. So, in other words, people like United Healthcare and Blue Cross and Blue Shield and so on and so forth are going to have to pay the reinsurance company $10 billion this year, $6 billion next year, and $4 billion every year thereafter. In addition to the aggregate contribution amounts under Clause 3, each issuer's contribution amount for any calendar year under Clause 3 reflects its proportional share of an additional $2 billion for 2014, an additional $2 billion for 2015, an additional $1 billion for 2016. Nothing in this subparagraph shall be construed to preclude a state from collecting additional amounts from the issuer on a voluntary basis. So, if the state says, hey, you got to pay more, then these health insurance companies have to pay more. Expenditure of funds. The provision under paragraph 1 shall provide that the contribution amount collected for any calendar year may be allocated and used in any of the 3 calendar years for which amounts are collected based on the reinsurance needs of a particular period or to reflect experience in prior period, and amounts remaining unexpended as of December 2016 may be used to make payments under any reinsurance program of a state in the individual markets in effect in the 2-year period beginning of January 1st, 2017. So, whatever money the health insurance companies pay to these reinsurance companies, if it's not all spent up by January 1st, 2017, they'll deduct that money from the premium that they'll have to pay in 2017. Hopefully you understood that. Notwithstanding the preceding sentence, any contribution amounts described in paragraph 3B4 shall be deposited into the general fund of the Treasury of the United States and may not be used for the program established under this section. Applicable reinsurance entity. For purposes of this section in general, the term applicable reinsurance entity means a not-for-profit organization. So in other words, the people that are heading up this reinsurance company can't make a boatload of money off of this. The purpose of which is to help stabilize premiums for coverage in the individual small group markets in a state during the first 3 years of operation of an exchange for such markets within the state when the risk of adverse selection related to a new rating rules and market changes is greatest. So what it is that when these health insurance companies buy this reinsurance, it stabilizes the premium. In other words, the premiums will go up massively because people like United Healthcare and Blue Cross and Blue Shield and the whatnot have suddenly acquired all these people with pre-existing conditions and they can't turn them down anymore. Okay. Entities are tax exempt. An applicable reinsurance entity established under this section shall be exempt from taxation under Chapter 1 of the Internal Revenue Code of 1986. The preceding sentence shall not apply to the tax imposed by Section 511 of such code. Whew. Coordination with state high-risk pools. The state shall eliminate or modify any state high-risk pool to the extent necessary to carry out the reinsurance program established under this section. The state may coordinate the state high-risk pool with such a program to the extent not inconsistent with the provisions of this section. Wow, oh wow, oh wow. So, now we know that our wonderful insurance companies that we pay into have to buy insurance for themselves to stabilize our premiums so we don't have to pay a buttload of premiums to keep our health insurance. A lot of education there. Alright, I will tell you more in my next video. Stay tuned.